Good evening, everyone. Welcome back to my channel. So, hindi stable yung connection. So, pasensya na. Medyo mahina yung connection natin ngayon. So, this interstitial cystitis. Hopefully, hindi siya mag-error or interstitial cystitis. Interstitial cystitis. Many of the symptoms of cystitis, frequent need to urinate, a burning sensation, a feeling of fullness in the bladder, can occur without there being a bacterial infection. Antibiotics are no help in these cases. How can you get a sensation of a full bladder and yet pass very little urine? What can be causing the burning pain if there is no infection? I have noticed that most people diagnosed with this form of cystitis, called interstitial or nonspecific, have a marked soreness in the tendons that join the abdominal muscles to the pubic bone. These lower abdominal tendons can easily get inflamed or strained due to injury, excessive strain, or the repetitive movements of some exercises or sports. I believe that the burning pain from the tendons gives a false impression of a full bladder and irritation inside it. The sensation does not originate in the bladder, but it feels as if it does. Following this hypothesis, many of my patients have found that massaging these tendons 3 times a day, just as described for a relief from severe period pain, is a successful answer to the problem. Thrush, thrush. Mhm. Having trouble connecting, please check your internet connection. Nag-error talaga siya. Thrush, Thrush. I'll try again. Kung pwede ba siyang masend. Thrush. About 75% of women will at some time experience an attack of thrush or vaginal candidiasis. Vaginal. Ang thrush is known candidiasis. Vaginal candidiasis. The most common cause is Candida albicans. Candida albicans. A type of fungus that thrives on the mucous lining of the throat, mouth, large intestine, and vagina. Candida is always present in the body but is usually kept under control. It gets the upper hand when its controls, such as bacteria in the gut or the body's immune system, falter. Diabetes, HIV, obesity, and me all open the way for this opportunistic fungus. Certain drugs, such as antibiotics, which kill good bacteria along with harmful ones, contraceptive pills, HRT, chemotherapy or steroids, and the chemicals used in condoms and tampons can also aggravate the situation. Symptoms are usually a painful itchy vulva and an excessive vaginal discharge, which is white and curd-like. The itching can cause ulceration from scratching. Sexual intercourse is uncomfortable, and it can be painful to pass water as urine stings the inflamed vulva. Some women find it gets worse just before their period. The infection can be so recurrent that it gives the impression of being chronic. Treatment includes antibiotics, steroids, chemotherapy, and anti-erosion. Sorry. Error talaga yung ano ko. Treatments. Conventional medical treatments of candidiasis calls an antifungal drugs and steroid creams used over a period of time. If the cause can be traced to a particular contraceptive pill or drug, then at least unavoidable, it may be necessary to stop using it. Since an excess of candida means that fungi and yeast have got the upper hand in the body, avoid yeast, fungi, and fermented products altogether. This includes bread, including pizza and flatbreads containing yeast, yeast extra spread, gravy granules, beer, including lager and Guinness, wine, vinegar, mushrooms, cheese, grapes. These carry a white fungus on their skin. Also avoid excess sugars and carbohydrates as these are the primary food of yeast and fungi. And do not drink anything that will make your urine more acidic, as this will further irritate your labia. The following are all healthful. The following are all helpful. Antifungal products such as caprylic acid, caprylic, caprylic acid, and grapefruit seed extract. Kadu and Cariato, natural Ayurvedic products that help to restrict yeast, candida, and fungal overgrowth. A vaginal compress made from a pad or cotton wool soaked in a live yogurt as a calmant. Zinc supplement, multivitamins to boost the body's ability to fight off infection. Neck massage for stress relief. Pelvic inflammatory disease or PID. PID. Pelvic inflammatory disease. Pelvic inflammatory disease is usually a result of an infection Try ko lang lumabas. Ito nga ako magpapasa. Para medyo stable. Sorry. Medyo mahina yung ano natin. Pelvic inflammatory disease. Pelvic inflammatory disease is usually a result of an infection or smaller complaint that has gone untreated and has developed into a problem that can have some serious consequences, including infertility. PID can arise from an infection such as Chlamydia. Hanggang dito, medyo ano pa din. That has spread upwards from the vagina. PID can arise from an infection such as chlamydia that has spread upwards from the vagina, inflation from an intrauterine contraceptive device, ovarian or tubular abscesses, or a complication after an abdominal operation. It can occur in several forms, one of the most common being acute salpingitis, inflammation of fallopian tubes. Acute sal salpingitis. Salpingitis. Oh my God, ang ano talaga na ano, connection, ang hina. Acute salpingitis. Pasensya na talaga, pa-off siya. PID can come in the form of a single attack, typically characterized by sharp abdominal pain in a temperature or become chronic condition. Symptoms can include acute abdominal pain, backache, unusual vaginal discharge or bleeding, a bout of fever accompanied by shivering, pain when urinating, feeling sick and losing appetite, resulting in weight loss. Treatment. Antibiotics are the most common method of treatment, but if the infection does not respond, surgery may be necessary. Adhering to the lifestyle program and supplement your diet with multivitamins and minerals will help improve your immune system and assist your body in combating the infections and coping with the side effects of antibiotics, which include thrush, intestinal candidiasis, bloating, gas, and lethargy, diarrhea, and occasionally a skin rash. Case study. A worrying irritation. A Middle Eastern lady had suffered from vaginal irritation for years, with symptoms of burning urine in an itchy and burning sensation in her vagina. Physical contact with her husband had become painful and uncomfortable. This was straining their marital relationship, and she feared that he would take another wife. She had seen several specialists who diagnosed the condition as non-specific vaginitis. Antibiotics were frequently prescribed without much effect, and in fact had brought about of thrush. She had also been prescribed steroid creams without much long-term effect. At this point, she came to see me in London. Her diet explained everything. She loved lemons, oranges, pickles, vegetables, chilies, and tomatoes, and drank freshly squeezed lemon in hot water every morning to keep her weight under control, a myth that many adhered to. And I advised her to stop eating and drinking anything acidic or sour and give her some Ayurvedic remedies to reduce the acidity of her urine. Within a month, the problem had disappeared. Hmm. Hindi pala siya maganda, no? Yung hot water. I drank freshly squeezed lemon in hot water every morning. Incontinence. Incontinence is an uncomfortable and embarrassing. Incontinence. Incontinence is an uncomfortable, embarrassing problem that, when serious, can affect your whole quality of life. Shame, depression, and a constant worry about the whereabouts of the nearest toilet can color everything you do. Bladder control can be impaired by many things, including age. In your 60s and 70s, your muscles, like your skin, lose elasticity, and there is a general loosening of muscles in the pelvic area, damage to the pubic region, an overstretched pelvic floor from a strenuous labor, prolapse, multiple sclerosis, where damage to areas of the spinal cord lead to malfunction of the nerves that control the bladder, complication resulting from an epidural injection, for pain relief in labor or for backache, nervous or psychological problems. Temporary or occasional problems can also be caused by diabetes, where it causes excess urine production, cystitis, chronic constipation, causing pressure on the bladder from distended intestine, increase in abdominal pressure from inflammatory condition, increase in abdominal pressure from inflammatory condition, increase in abdominal pressure from laughing, sneezing, coughing, etc. Treatments. A urinary tract infection or problem in the wake of childbirth are common causes of incontinence. or so, the first step must be to consult a urologist or a gynecologist to find out the cause. Treatment will depend on diagnosis. If, as is quite often the case, a contributory cause is weakness rather than permanent damage to the pelvic floor muscles, strengthening this will make a big difference. For a simple pelvic floor exercise in the yoga pose for another helpful variation. Your doctor may also suggest biofeedback, which uses an electronic pressure catheter to teach you control over the muscles that close the urethra. The following will also help ease the problem. Avoid cold water in chilled drinks, ice cubes, coffee, or caffeinated drinks, which are diuretic. Alcohol, excess salt, canned products, very spicy food, citrus, and sour fruit. Don't limit your fruit intake. No, no. Don't limit your fluid intake, but drink only in small amounts at a time throughout the day, rather than taking large draughts all at once. Massage about the pubic bone. This may relieve the urgency and subconscious urge to empty your bladder. Relaxation and visualization techniques are very useful. There are drugs available for extreme cases, but these can have side effects. Uterine or vaginal prolapse. Uterine or vaginal. Parang hindi na siya, ano, pasensya na paputol-putol talaga yung mahina talaga ang connection ko. Uterine or vaginal prolapse. The pelvic floor is like a basic is a basin supported at its rim by the coccyx. Tailbone. Coccyx or tailbone. In lower parts of the pelvic bone, this base Wi-Fi. Anong paputo-puto talaga? This basin is what supports the weight of all the organs in the pelvis. Weakness in the muscles or ligaments of this basin or increased pressure on it can cause an area to herniate, which means that without support, an organ such as the uterus can drop or prolapse. There can be vaginal, urethra, or rectal prolapses. Uterine prolapses usually happens due to the strain of multiple birth, obesity and chronic severe coughing, probably from asthma or bronchitis, local conditions such as fluid retention in the abdomen, fibroids or other tumors that have grown large, excessive high impact exercises, especially if you have fibroids or a tumor, or heavy weightlifting over a period of time. Weakness of muscles and ligaments of the pelvic floor. Prolapses vary greatly in their degree. Mild prolapse is felt as a firm mass in the vagina. With moderate prolapse, the cervix has descended to the lower part of the vagina. At this stage, it may feel like sitting on a ball or something is falling out. There may be a feeling of heaviness in the area, low backache, and abdominal pulling, and some incontinence of urine. In severe prolapse, the cervix appears outside the vagina, inverting the vaginal wall. Being exposed to the atmosphere causes the exclusion to become dry, open bleeding, and prone to forming ulcers. There may be unpleasant discharge or bleeding. Pressure on the bladder will affect urination. Urinary tract infection is a common complication, and there may be constipation or hemorrhoids, or defecation may be painful due to pressure on the colon. Treatments. Prolapse doesn't usually happen suddenly, and acting on early warning signs can prevent the problem progressing to the advanced stages. Pelvic floor exercises can help, but only in the initial stage or if the prolapse is mild. There, these exercises are also an important preventive measure. Postmenopausally, estrogen therapy helps maintain the tone of the pelvic floor. A vaginal pessary can cause to prevent a mild prolapse from getting worse. With some serious degrees of prolapse, surgery may be the only option. Asana to exercise the pelvic floor. Asana. Asana. Asana to exercise the pelvic floor. Stand erect with feet hip distance apart. Breathe in and divert all your attention to your pelvic floor, letting it go and visualizing it bulging downwards. Breathe out and at the same time suck your pelvic floor up as high as it will go. Hold for a count of 5 each time. This requires a bit of practice, but once perfected, it can help to strengthen the pelvic floor muscles. Do this 2 or 3 times a day, preferably on an empty stomach. Oh my God. Naging okay din siya. Ang dami din palang na ano dun sa ano no? Sa mga vaginal na ano, no? Vagina na problem. So, kailangan talaga siya. More pelvic exercise, neck massage, and then relaxation and water. So, kailangan talaga ng ganun na ano, pangangalaga sa katawan ng babae. Dami talagang concern issues. So, gandang gabi sa lahat. Thankful ako at naging okay din at the end. Hindi na naging ano yung ano, signal. God bless. Hope you like the things that I've read today. God bless. God bless everyone. Bye-bye.